Airport Council International, in collaboration with Transoft Solutions and IBIA Consulting. COVID-19, the impact of physical distancing on security checkpoint operations. COVID-19 has created an unprecedented global challenge, particularly to the aviation industry. A variety of new measures has already become a necessity throughout the passenger's journey to help to prevent the further spread of the virus. For airport operators, the main principles are to protect the health and welfare of travelers, staff, and the public, to minimize the opportunities for dissemination of the virus, and to maintain efficient operations. Airports Council International, ACI World, and ACI Regions have published comprehensive guidance for airports as they prepare to restart operations. In addition, ICAO Council Aviation Recovery Task Force, CART, has published detailed guidance in their takeoff document to assist with the harmonization of measures globally. During the restart and recovery phase, it is recommended that physical distancing is implemented across the airport where practical. One of the areas where physical distancing may not be possible as traffic levels grow is the security checkpoint. ACI World, in collaboration with Transoft Solutions and IBIA Consulting, have conducted detailed modeling and simulation of throughputs at the security checkpoint and the impact physical distancing has on the queue capacity. The results suggest that physical distancing severely limits checkpoint capacity, and the queue will overspill into the terminal area, causing other operational, security, and potentially health problems. As part of the modeling and simulation work, ACI World has suggested measures that may mitigate the need for physical distancing while maintaining a safe and healthy experience for all passengers and staff. The following simulations in this presentation were created using Transoft Solutions ArcPort, a fast time simulation software focused on the analysis of passengers and baggage in airport terminals and other passenger transit facilities. Focusing on lane opening sequence, the availability of divest positions where a passenger prepares their tray for screening, and space per passenger, 3 different configurations of the security checkpoint will be compared against the pre-COVID operational baseline. These include 50% of lanes open and 50% of divest positions open, 50% of lanes open using all divest positions available, and all lanes open but with 50% of divest positions available. Let's take a look at pre-COVID operations. All divest stations available, 2 lanes or a cell feeding into a walk-through metal detector. These simulations have been based on the model which assumes serial loading setup with 2 preparation positions, 18% walk-through metal detector alarms, metal and random, 10% of bags that require searching. This model achieves throughput ranging from 240 to 280 passengers per hour per cell, meaning a pair of lanes sharing a walk-through metal detector. Modeled performance of these lanes will be used to generate a security checkpoint designed to achieve optimum level of service as defined in the IATA and ACI Airport Development Reference Manual, ADRM. 1 to 1.2 meters squared per passenger under pre-COVID operations. Waiting times do not exceed 10 minutes, and as a result of the previous assumptions, the queue capacity is designed to hold up to 140 passengers at 1 meter squared per passenger. Changes to the pre-COVID space per passenger provision will define new queuing capacity, assuming no changes to its existing queuing footprint. Assuming a high degree of physical distancing for the post-COVID operations, queuing capacity may be reduced by 75%. For the queue system in this case, that would mean a reduction down to 35 passengers compared with 140 for the pre-COVID operations. With these changes in mind, and looking into the first scenario, 50% of lanes are open and 50% of divest preparation positions are available. 2-meter distance between each passenger. 50% of repacking stations are also closed. It can be observed that because of the limited equipment available, it has reduced the number of passengers within the security checkpoint. While this supports the physical distancing, the passenger throughput in this configuration may drop to 30 to 40% of its original cell performance level. Because of the significant increase in passenger separation, the queuing capacity is also significantly reduced. Under this configuration, 50% of lanes and 50% equipment available, the expected breaking point of the security checkpoint system is at 30 to 35% of the original demand. Queues build up and extend into the terminal area, causing security and health concerns. Looking into the second scenario with 50% of lanes open, every other lane closed, but all divest preparation positions available. More passengers will be able to use the divest preparation stations open. This results in passenger throughput of 40 to 50% of the original pre-COVID performance level. However, a system breaking point of 40 to 45% of the original demand based on the reduced queue space capacity. The last simulated scenario assumes all lanes are open, but with 50% of divest preparation positions available. In this case, even more passengers will be able to use the divest stations available, which results in the throughput of 60 to 70% of the original performance level. However, a system breaking point of 55 to 60% of the original demand based on the reduced queue space capacity. As we can see, physical distancing will not work for the security checkpoint when traffic levels increase. In order to reduce the need for physical distancing, a layered approach to mitigation measures is suggested to maintain the health and well-being of passengers and staff at the security checkpoint. These include pre-travel testing, temperature screening, face masks, hand sanitizer stations at the checkpoint, installation of plexiglass, continuous tray cleaning or UVC automated cleaning, crowd monitoring software, changing lane opening sequence, time slots for screening, touchless processes, rapid COVID testing solutions under development. Thanks for watching. Want to know more? Get in touch.